In 2014, the Mississippi State Department of Health began an intensive initiative to really assess our state's health. They met and discussed issues with partners or stakeholders, the community, you and me, and they collected and analyzed data to determine just what priorities require our focus.
The state health assessment is something that we felt like we had always been doing. We'd always been looking at the statistics of the state to look at what the health of Mississippians really was. But what we wanted to know was more in depth than that. We wanted to know what the citizens thought was important as far as health goes, and more than just our numbers, what kinds of things are affecting health in the state.
We planned probably for more than a year and a half to actually start the process in June of 2014.
We did surveys, more than 19,000 surveys, both online and on paper.
It was distributed throughout the 9 districts and the 82 counties, and so with those 19,000 surveys, we got a snapshot of almost 3 million people in Mississippi. It was very important to reach all communities and all types of individuals, different races, different poverty levels, different income levels.
The community know what they want. They know what their needs are. They were very motivated and very inspired to be a part of the process.
We did 48 focus groups across the state. We had more than 150 partners that we talked to.
The assessment process grew with each meeting. More people wanted to be involved when they started hearing about it, more partners, which was really exciting to me.
A partner could be an individual or an entity with shared interests. Partners share in the decision making, they share resources, information, responsibilities, and credit. I was part of a retreat that was held to address the public health system. The retreat was one of the primary assessments. People were excited about really coming together to come up with solutions for how we can address the many challenges that are facing us in the state regarding public health.
Once we had all the data, we had all the assessments, and we brought them back to the partners. We were in a meeting and had probably 150 people there, and we just started talking through all the things that, as I would say, floated to the top.
We looked at a couple of different kinds of criteria when deciding on the focus areas. We looked at what affects the most people in Mississippi. We looked at what we know about public health, and where we came to was the decision that we want to focus on 4 areas. We want to make sure that people are graduating high school. We want to make sure that when babies are born, they're healthy, and so are their moms. We want to make sure that people are able to live healthy lives. And we want to make sure that people who are at risk for diseases like diabetes or who are at risk for obesity are able to reduce that risk.
Because if we're going to make a difference, we are going to have to get together, and we're going to have to pool our resources and work in one direction to move the needle.
First came the state health assessment, which was an assessment that was done across the state within all of the 9 public health districts. We utilized the data that came from the state health assessment to develop the state health improvement plan.
This is not one of those plans that's going to sit on the shelf. This is something we all have to work on and be involved in.
And that was one of the things that Dr. Courier said to us in the beginning. She said, if we do an assessment, I want to do an improvement plan, and then I want us to stick with it, because the improvement process is really when the work starts, because you gather together work groups around the priorities that you've chosen, and then they figure out what action plans, what action steps they'll take to make improvements.
What really gives me the motivation to continue is that it's not over. It just wasn't collecting surveys. And it's good to be able to report back to the community that it's not over.
So our 4 priority areas dealing with chronic disease, educational attainment, infant mortality, and a culture of health were kind of the 4 primary areas that that we're not only focusing in with the SHIP, but we're also focusing in on those for our own agency strategic plan. Identifying available data, using that data to help identify gaps and areas that we need to improve. And I think that all of that data coming in will help us better assess our timeline for what we can accomplish reasonably within the next 2 years. Change is tough, but I think that we have a mechanism to make improvement, to make the necessary change, and we have the support that we need to do it.
Think about this. People who have higher levels of education are more likely to have healthier diets. Think about this too. An individual's future and employment is linked to their education. Chronic diseases are a personal drain on their finances and our state. Babies, well, if they're born healthy from the start, they are far more likely to grow into healthier adults with less health care needs. For all these reasons, our preparation, our focus, our targeted action planning are necessary in order to have a substantial and also a lasting impact. So with guidance from the Mississippi State Department of Health, their partners in this community, we can build a healthier Mississippi from the ground up.
We want to work towards those goals that are within those plans to improve health for everybody in the state.
I know that if we continue on the path that we're going, that we can not be the bottom of all the health data and the health statistics. I believe that we can move the needle, we can make a difference.
Perhaps the most amazing aspect of this whole process to me as a lifelong resident of Mississippi has been the freeness with which people have given their time for the development of a plan to move the state forward.
When you see people truly say, we've got the data, we know where the problems are, we know what best practices to implement, you feel that you can see your job, you can see the benefits of your work in the community.
I do believe it's one of those things that you don't want to miss out on.